What is the meaning behind abortion is healthcare? It could mean as long as the medical board signs off, it is acceptable. But what does it imply? The procedure or protocol has passed through layers of legal, clinical, and regulatory review. It doesn't mean it is morally perfect. It doesn't mean it's pragmatically applied without contention. It means it is allowed within the system. It reflects what is permissible, not always what is optimal. Behind every sign-off is a framework called medical bioethics. It is built on 4 principles. Autonomy, respect the patient's right to choose. Beneficence, act in ways that promote well-being. Non-maleficence, do no harm. Justice, ensure fair and equitable care. These principles aren't rigid laws. They're balancing beams, especially under pressure. And pressure comes fast in a crisis. Abortion is healthcare. What they're really saying is that abortion falls within the domain of healthcare and therefore should be evaluated using the same ethical frameworks that govern all medical care. That means medical bioethics applies, and when applied, it often supports abortion as a permissible and sometimes necessary intervention. Abortion is healthcare as an ethical claim. When someone says abortion is healthcare, they're not just making a clinical statement. They're making a bioethical assertion. That abortion involves medical decision-making. That it engages the same principles used to guide surgery, cancer treatment, or end-of-life care. That it deserves the same ethical protections and institutional legitimacy. Applying the 4 principles of bioethics. Here's how abortion fits within the standard bioethical framework. Autonomy. The pregnant person has the right to make decisions about their own body and future. Beneficence. Abortion may promote well-being by preventing suffering, preserving mental health, or protecting life in cases of medical risk. Non-maleficence. Denying abortion may cause harm physically, psychologically, or socially. Justice. Access to abortion must be equitable, not determined by geography, income, or identity. When bioethics is applied, abortion is often seen as ethically permissible, especially when grounded in autonomy, harm reduction, and equitable care. Institutional sign-off versus ethical depth. Medical boards and healthcare systems may sign off on abortion protocols, meaning they are legally and professionally authorized. But that sign-off is rooted in bioethics, not just policy. So when people say abortion is healthcare, they're invoking a deeper truth. This isn't just a political issue. It's a clinical, ethical, and human one. Examples of adherence to bioethical protocols. Crisis Standards of Care, CSC, Ethics in Emergency Protocol. In a mass casualty incident or statewide emergency, CSC protocols are activated when demand exceeds capacity, for example, ventilators, intensive care unit beds, staff. Standard care is no longer feasible. Triage decisions must prioritize population-level outcomes over individual preferences. Probability versus duration in CSC. Patient A, high chance of survival, shorter life expectancy. Patient B, lower chance of survival, longer potential life. In a mass casualty event or statewide emergency, the system shifts. Crisis standards of care are activated. Resources are scarce. Choices compress. Triage becomes a regulatory fulcrum. Not everyone can be treated. Not every life can be saved. Who gets the ventilator? Under CSC, the protocol might favor patient A because resource efficiency, higher likelihood of successful treatment. Maximizing lives saved, a utilitarian approach. But some CSC frameworks, like those informed by life years, saved, or age-weighted scoring, might favor patient B, especially if pediatric ethics or long-term societal contribution is considered. These protocols are typically authorized by state health departments, governors, or medical boards, and they shift the ethical lens from individual-centered care to public health ethics. They, in many cases, utilize specialized branches of bioethics that add weight to different calculus outcomes. Let's clarify and reiterate. While medical bioethics provides a principled framework for care centered on autonomy, beneficence, non-maleficence, and justice, not all medical decisions or systems follow it. There are real-world scenarios where care deviates from these ethical standards. Scenarios outside bioethical boundaries. Medical care may fall outside bioethics when an individual doctor acts alone, making decisions based on personal bias, ideology, or pressure without institutional oversight. Malpractice occurs where harm is caused through negligence, recklessness, or intentional misconduct. Alternative or unethical frameworks are used, such as market-driven models that prioritize profit over patient welfare, authoritarian or discriminatory systems that override consent or equity, cultural or political ideologies that distort medical judgment. In these cases, bioethics may be ignored, diluted, or replaced. Examples of ethically deviant frameworks. Some non-bioethical frameworks have historically permitted or justified sex selection, choosing embryos or terminating pregnancies based on desired gender, often reinforcing patriarchal or cultural biases. Race selection, preferring or excluding genetic traits based on racialized criteria, raising profound concerns about eugenics and systemic discrimination. Forced sterilization, targeting marginalized groups under the guise of public health or economic control. Non-consensual experimentation, violating autonomy in pursuit of data or innovation. These practices may be framed as medical, but they are not ethically sound. They reflect instrumental logic, not principled care. Reframing. So when we say abortion is healthcare or medical boards sign off, we must ask, is bioethics truly being applied, or is another framework at play? Sign off without ethics is a hollow rationale. Care without consent is not care. Selection without justice is not medicine.